Hello, everyone. Thank you so much for joining us. My name is Robert. I will be our moderator today. And we know we got a couple minutes for folks to keep joining. We're going to probably get started at 12:03, give folks a couple of minutes to sign on. So if you need a last minute break for any reason, please feel free to do that. We'll get started in about 5 minutes. But thank you guys so much for joining. All right. Once again, thank you guys so much for joining us. We're going to wait just about 3 more minutes for folks to log on. So if you need to step away for some water or anything, please feel free to do so. But we're very excited to get started in just a couple of minutes. All right. Well, I think we can go ahead and get started, even though it's not quite 12:03. But I am really, really excited for today's conversation. So thank you guys, everyone, for joining us today. As I mentioned earlier, a couple of minutes ago, my name is Robert Hess III. I am the founder and CEO of Hess III Consulting, which owns the Health Insights Hub, which is what we're here for today. And our conversation this afternoon is going to be with Scottsdale Recovery Center. I'm going to do some introductions with all of them in a minute. And we're going to be talking about innovations in justice reentry and social determinants of health. And we are really thrilled to talk about and share all of the things that have been going on over at Scottsdale Recovery Center. This is just a gentle pause reminder. This is our content. We love to share it. Just please reach out to us first, and we will gladly do so. Very briefly about us, Hess III Consulting has been around since 2007, and our mission and work is to design, implement, optimize health systems. We do that in a lot of different ways, both here in Arizona, where we are based, and then also nationally. We've had the honor of working in about 43 different states with over 200 organizations doing all kinds of different stuff. So to unpack who we are just a little bit more, we are actually three kind of arms or pillars of the company. So the first one that most folks are most familiar with is the Health Innovations Network. That is our traditional advisory consulting services, where if y'all have a need, give us a call. We're happy to help. The second arm or pillar is our Health Insights Hub, which is what we are participating in today. This is really centered around market intelligence, professional development, workforce development, and really helping people hone and inform their strategies. And then I'm even more excited to talk about the health impact community, which we recently secured our 501c3 status, and that is really focused on our corporate giving and our commitment to community, and we'll talk about those in a little more detail. So within the Health Innovations Network, our advisory services, we focus on a couple of core areas, but ultimately, our mission is to lock arms with health and human services organizations, whether that be at the government and public sector level, the payer level with managed care organizations, or with providers, and then, of course, vendors and investors that work and support with those providers. So we have a network of about 100 experts. Most of them have over 20 years of experience, and they all have their various subject matter expertise. So we would love to chat with you more about that. The Health Insights Hub, again, really focus on market intelligence, and that is what we do, or how, through which we do these Power Hour trainings. Every month we do a free webinar on various topics. I am really excited to announce that next month we are partnering with the Arizona Public Health Association, and we're going to be talking about Arizona's statewide efforts around saving lives through heat relief. We've got a lot of really great insights and innovations that are going on there. And for those of us that work in behavioral health or with Medicaid, we obviously know the interdependencies and relationships between the populations we serve and heat exposure. And so this conversation is going to be really exciting. We hope that you will join us. There's a registration link at the bottom of the page there. And then another thing, and we just totally overhauled and revived this, but we produce a monthly report called the Hess Report, and this is specific to Arizona. It offers market intelligence, so it gives you kind of a finger on the pulse of what's going on in Arizona Medicaid, in child welfare, in the justice system, at the population level. And just this month, we have officially converted that over into a Power BI dashboard. So now it is live on our website, it's interactive, and it's completely free. So that data can be used to help inform and drive strategies or understand kind of what's going on in the Arizona health and human services industry. So we're super excited to launch that. Like I mentioned, it wasn't a PDF form before, and we just converted it over this month. So please go check it out and give us feedback. And then that third arm that we discussed is the health impact community. And like I mentioned, we recently obtained that 501c3 status. And through the impact community, we seek to do a couple of different things. Every month, we host a networking event. Those events are statewide, so they rotate quarterly, basically. So this month, we're going to be down in Tucson. Next month, we're going to be up in Flagstaff, and then we'll be back in Phoenix. So please follow us along on the internet, whether it be LinkedIn or on our website, our email, and you can always get updates on where those will be and when. Every month also, we do host volunteering events to give back and also to support the capacity of community-based organizations. I was just reading a news article today that SNAP benefits, food assistance, food stamps, have dropped by over 51% in Arizona. And every food bank in town is like out of resources, right? They are desperate for volunteers and for people to come help them fulfill their mission. And so that is what we do. Every month we organize a volunteering activity. We choose a different community-based organization to support, and then we go and roll up our sleeves and serve our community. So we would love to have you join us at any of those opportunities when they work for your schedule. And then finally, the third thing we're really excited about is that we recently just opened applications or availability for our scholarship program. And to kind of meet the moment, we also refined and focused the scholarship really to support frontline workers. So we are investing in subsidizing or supporting folks that are pursuing peer support certification, certification as a community health worker, or as a nursing assistant. And so the application's on our website. If you or someone you know is interested in getting that certification, let us know. Go send them our way, have them fill out an application, and we'll be happy to support the success and growth of those critical, entry-level frontline workers. So that's enough about us as an organization and who we are. Let's dive into what we're here today for. So as you mentioned, or as I mentioned, excuse me, I'm Robert. My role today is largely to serve as a moderator, and I'm super excited to talk about the work of Scottsdale Recovery Center. So we're going to be hearing from Michelle Siwek, who is their owner, Lee Yaiva, who is their CEO, and Michelle Sproule, who is their Chief Clinical Officer. And so let's dive in and start talking about all of the stuff they've been doing with innovations in justice reentry and social determinants of health. So Ms. Siwek, good morning. I guess it's now afternoon. How are you doing this afternoon? You're on mute, my friend.
Hi, here I am.
Awesome.
Good afternoon.
Hey, do you mind taking a couple of minutes and just sharing with us about Scottsdale Recovery Center, its background, when it started, who you are, what you do?
Sure. So my name's Michelle Siwek, and I'm the owner of SRC. SRC has been around since 2009 and really came from humble beginnings. It was just a 10-bed sober living home. And then over time, the company started to retain the expertise to really get into treatment. And so they opened an outpatient clinic, got Joint Commission accredited, then went into the residential treatment space. And then I stepped in 2019. And we've been going like crazy ever since. So we opened a detox. So we have the full continuum today. We have 58 sober living beds. No, 68 sober living beds and residential and detox. So I think we have a little over 200 individuals in treatment today. So back in 2019, we had 20, and we've really been growing ever since. So that's the short version of all things SRC.
Yeah, I love that. Sproule, forgive me because there's two Michelles. We call each other by their last names, and so
we've lovingly agreed to this over the years.
Just so we can keep our sanity. And so, do you mind sharing a little bit about your background individually, your why, and your role at Scottsdale Recovery Center?
Sure. Hi. Thank you for having me. My name is Michelle Sproule. I'm a licensed professional counselor and the Chief Clinical Officer of Scottsdale Recovery. I have been with the organization since 2017. So the humble beginnings that Michelle was talking about, I was there for all of it. The very teeny tiny little organization we were to the monstrosity we have become. My clinical background, I initially started this work in the child system of care, so the children's system of care. So I originally was working at an intensive outpatient for a nonprofit, specifically with substance abuse. And that's where a lot of my interest in working in this particular industry started, including some of my own struggles from back in the day. So the two things I said I did not want to do when I started working in the field was substance abuse and children. And that was my first job in the field. Fast forward a few years later, I ended up at Scottsdale Recovery. And my passion today really just, we see so much of the difficulty in the community that we serve, and the ability to see the outcomes and the way that folks can flourish when you give them community and support is astronomical. So My role at Scottsdale Recovery includes oversight of all of the clinical team, and I also do a lot of the compliance and credentialing. Like you kind of name it, I do it here. So super proud to be a part of this organization.
Yeah, perfect. And Lee, do you mind kind of sharing a little bit more about your background, your why, and the things that you oversee today?
Absolutely. Good afternoon. My name is Lee Yaiva, Pakiumor from Smokebury, Arizona, full-blood Hopi from the Hopi tribe. I have been with the organization since 2017. I've seen the entire evolution of the organization, but also my beginnings were as a recipient of services in the behavioral health spectrum, and really kind of having a firsthand experience, lived experience through the design of the industry and how I believe that we could impact the industry in a positive manner. And so coming in as a recipient initially to getting into the industry in 2005 as a peer support BHT, and then just gradually going from various organizations to get to where I am present day. So it's been an extreme honor to be a part of the organizational development and the progression of the industry, but also today is my 9th year actually with the organization. So I'm celebrating 9 years with the organization. But my why is definitely because of lived experience, having been a homeless, alcoholic, and drug addict living off the streets of Torrance, California, seeing the disparities within tribal communities, having been in incarcerations throughout the entire country, and just a multitude of experiences that have really defined who I am and what I do present day. So that's in a nutshell who I am, and what I do with the organization today is multi-tiered, everything from first-hand delivery, client-facing, facilitating groups, doing mentorship, sitting in sweat lodge ceremonies. So I'm very involved and proactive with engagement, and it's just an honor to be here. It's an honor to lead the organization and to see its evolution over the past 9 years.
Yeah, absolutely. And thank you for all of that. And to thread this needle, we started working with Scottsdale Recovery Center around that same time, 2019, that many of the folks joined. So even as an external party, it has been really cool to walk alongside them as the organization has evolved. And so let's start talking about that a little bit more. So I want to turn our attention to the justice reentry work that Scottsdale Recovery does. And I know that the original genesis or kind of footstep into this space was initiated by Access's targeted investment program that many folks in Arizona participate in. So Michelle Siwek, I'm going to ask if you don't mind kind of kicking us off and talking about how did this work come about? What were kind of the internal conversations, if any, on better serving justice folks, and talk about kind of the process for getting involved in justice work initially?
Sure. So when we started looking at the application to become a targeted investment participant and the kind of the justice arm, we had already experienced outcomes from our clients where it was really just simply this constant circulating through the system, and the needs of these clients were not being met. So their drug and alcohol problem was creating these charges that ended them back in prison. So and those that have been in the business, we see that all the time. And so we really wanted to get focused on that and see if we could change that. And I remember when we were going through the application process, we were reaching out to Department of Corrections directors and trying to just gain some insight about what their needs were, what their barriers were, the recidivism rates. You always hear about Department of Corrections in the news, and it's usually not because things are awesome, like something's happened, and they're reacting to a situation. And so really trying to understand where their needs were was a big deal. And I remember specifically a conversation with Department of Corrections, and they just said, well, we think it's fantastic that you want to help us, but we don't really discharge individuals to sunny Scottsdale. And I said, oh, well, why don't we just try it? Like, what would happen if we just tried? And but that was the beginning of a really interesting relationship with Department of Corrections. And after we were awarded, like that really was when the real work began. So that was a little bit about how we got started. And we just wanted to make a difference because we saw this constant, you know, retread of the same clients over and over again, and they would come to us with more charges than they had before. So we thought we could impact and change that.
Yeah. Sproule, I'm going to kick this over to you. This diagram that we have up on the screen kind of reflects kind of the service delivery model to a certain extent that was developed for your health justice program. Do you mind kind of talking through some of these elements and maybe describing, what they look like in real life today?
Sure. So a big piece of our health justice program is really focusing on the various dimensions of wellness for every individual that we serve. And a big piece of that includes not only like their behavioral health care and their medical care, but all of the other healing pieces that support somebody to leave an effective and fulfilling life outside of an incarceration setting and out into the community and beyond. So a few of the things that we really started to focus on in this process were not just the behavioral health, because we already pretty much had that on lock with the treatment programs that we have, but integrating further with primary care and all of the medical concerns that an individual might have. Substance use recovery is a huge part of what we do. We're a dual diagnosis facility, and a lot of our folks are in recovery themselves. So we enhanced our peer support models to support individuals, both in the reentry side and also when they're out and in the community. I'm not going to touch traditional healing models. I'm going to let Lee talk about that when I'm done. As Michelle had mentioned, we also have really focused in on our safe, stable, supportive, sober living homes and our housing models so that we have community for folks to enter into as they're transitioning into the community. Making sure that they have supervision and support, that they're connected to other folks that are also in recovery so that they have that community-based aspect. We also look very deeply into vocation and education. How do we help folks get the education that they need, whether they need their GED or they want to pursue further education, and a ton of work on their resume support, interview skills, all of these different pieces, which is a part of our Social Determinants of Health Center, which I'm sure we'll touch on in a bit. Meaningful daily activities is absolutely a critical piece of anyone reintegrating into the community. So folks need to be able to have something that brings life to them, something that gives them a reason to get out of bed. So we help work with our clients to identify what those things might be for them so that they can continue to integrate those into their daily lives. And we also have a focus on family and natural supports. It might not always be their blood relatives, but we want to make sure that we instituted a process for folks to engage with their families, either through traditional family therapy models, or we also offer a family workshop every single week that folks can participate in. It's a family members only right now, so that way the family members can get the supports that they need while they're helping their individuals kind of move through reintegration into the world. Did I miss anything?
Yeah, you nailed it, and not in the Netflix show way, in the good way.
And then I'll let Lee talk about the traditional healing.
Yeah, and so Lee, I was absolutely going to kick it over to you and ask you to talk about traditional healing, and if you can also talk about kind of the impact to the organization, staffing, and I know that there was so much operational side beyond the clinical stuff that Sproule was talking about. So if you'll please share about traditional healing, but then talk broadly about what starting this program and launching this program looked like, from that operations perspective.
Okay, I'll start with the operational piece. It was a very meticulous process of execution for our organization. So what it was really making sure that we had individuals that were in direct alignment with those various components of execution. So as we started to develop, we started to looking we started looking at people with lived experience, a passion or conviction about addressing various aspects of implementation. So being very defined about how we were going to implement that process, and ultimately it was very successful. So a lot of people that we didn't realize were so committed and were very proactive advocates of this opportunity kind of just came out of the woodwork because the framework didn't exist prior. So once it was produced and we started to communicate that with the organization, people started to have a vested interest just from either personal lived experience or just maybe it was a family relationship or a friend that had gone through an experience and they wanted to be contributing members to this effort. So that was really what kind of refined the process of implementation for us as an organization. On the the traditional healing component of the organization, I really take tremendous pride in being able to influence and implement programmatic structure that is going to be very specific in nature to who we are and really reinforcing the culture of the organization. So it's not a standard practice. It's something that's very refined in a manner of even when we're doing food, right, which is a very customary piece of our organization as it relates to the tribal community. It's not just us having Indian tacos. It's us really going back into reflecting about how Indian, Native American, whether how you call it Hopi, Indian taco fry bread, in that ideal and how it was developed. It wasn't something that it's a marketable piece today. You know, you have people kind of selling it and kind of pitching it from a tribal perspective, but in reality, it came from a position where they were in encampments, and the only thing provided to that community was flour and water, and they had to figure out how to create sustainability and maintenance efforts to preserve life for that particular tribal community. So we're teaching historically how that influenced today's society, but also making sure that we pay homage to the practices that led to us being in present day society. And so it's all those kind of things. We have cultural practitioners that come all the way from New Mexico to facilitate our sweat lodge ceremony. And that says a lot because it's a 5-hour drive for them to come facilitate, but they believe so much in who we are and what we do and the integrity that we practice in consistency in the delivery of service to the tribal community. So all of those things together really refine this process for us in regard to the tribal healing component. But in addition to that, I think there's just a lot of things that have established barriers to and accessibility to care. So us functioning from where we function, I think it really closed up the gap to ensure that there's integrity, there's transparency, there's cohesion, collaboration under the TRIBA, and all of those things really kind of refine the opportunity for us under this umbrella.
Yeah, absolutely. And thank you so much for spotlighting that. I remember the first time we started talking to ADHS about doing a sweat lodge ceremony on site at a licensed healthcare facility, and their eyes crossed and their brains exploded, and they didn't know what they're like. We don't know how to regulate this, and you're like, you don't have to. And so, yeah, I think having that capacity on site is such a critical element, and the commitment to serve tribal members. One thing that was obviously happening contextually and almost concurrently along this, was all of the reports and all of the news and tragedy around what was happening in Arizona's tribal communities due to those bad actors. And so having that opportunity to not only build trust with those communities, restore trust and repair, but also then provide a traditional way to bring healing, right, in ways that resonate with them and are, reflective of their beliefs and culture. I think that is such a great program. So thank you for spotlighting that so much. And so looking at how this program evolved, it started with the targeted investment program. And for those of you guys that are not familiar with Access, is Arizona Medicaid's targeted investment program, they essentially offered some value-based payment money or some, financial incentives for organizations to go spearhead partnerships with justice partners, such as the Department of Corrections, Sheriff's Office, things like that. Scottsdale Recovery Center was able to secure a partnership with the Arizona Department of Corrections, Rehabilitation, and Reentry. And after we got started with this program, it wasn't too long until they were invited, or ADCRR invited SRC out to participate at the Maricopa Re-entry Center. Siwek, I think I'm going to kick this over to you and ask you to talk just a little bit about what the MRC is and the work that SRC started out there and what that looks like.
Sure. So these are some pictures of the MRC. It's right off of I-17 heading to Flagstaff, right? Pinnacle
Yep,
Peak and
yep.
I-17. And it was originally for adolescents, and then Department of Corrections took it over. And it's really a very unique, there's only a couple of these in the entire country that are operated by the prison systems. And what this one is specifically aimed to do is those individuals that are on community supervision, which the kind of the old term is parole, community supervision. If they violated any of the terms of their community supervision, their parole officer can send them to the MRC. And it's almost like that one step before heading back to prison. So it is it is like their last chance, and they've, kind of messed up. So they arrive, their parole officer will either say you're going to be here for 30 or 90 days. They can leave anytime they want, but we provide services out there to help them get back on their feet. So Scottsdale Mat Clinic, which is another agency that I own, is out there as well. And it's really about giving individuals resources that they need that maybe they didn't get when they first were released from prison, and really trying to set them up to keep them out of prison. And we've had a lot of success there. It's really interesting, the dynamic and how things have changed. SRC does do peer support certification for those individuals out there currently. And we're, the end goal is if they came to us struggling with addiction, they, maybe failed a UA, we try and get them, there's groups, case management, peer support services. And then if they're interested in getting into behavioral health and they want to take that peer support certification, we absolutely will help them with that as well. I think that's about it.
Yeah. Yeah. The MRC is really a unique place. I mean, it just really is, as a diversion program to prevent reincarceration. It does create that last chance, so to speak, that Siwek was referencing. And the way that SRC was able to initially go out there, at the time that they went, ADCRR did not have the resources themselves to offer or facilitate programming. And so SRC kind of came in and stepped up to the plate and offered to basically fill that gap and fill that void. And that did include, again, with some of those primary care services, behavioral health services, but it really is also about those wraparound services around those meaningful daily activities and that vocation and educational support, setting people up for housing support when they were ready to be released from that facility. And so this model, what was interesting is that we had seen it be successful in the community, right? Out through with like traditional reentry, 60 days before someone gets released, you go in, do some screening, how that process was initially conceptualized. But then to translate this model to an on-site facility, while it's not a BERF, it's not even a licensed level of care. It is, from a Medicaid or licensure perspective, it's a community location. But from like a functional perspective on day to day, you have folks residing on site while they are accessing supportive care, right, and treatment. And so being able to translate this model into that environment, I thought was just really, really fascinating. And as Siwek alluded to, the sister company or affiliate company, SMC, they've continued that work. So this became the foundation, and they have been able to continue that work over at the MRC, which is just a really fascinating element. I'm going to pause real fast because Jill Rowland, I think I saw you had your hand raised, and I would love to take a question. Yeah.
Okay, and you may have answered it, and thank you, Michelle and Robert, for describing that program. So is it, if a person is coming out into the community, are they able to go there? Or it's if they're in the community and they're having challenges, then they may be able to go there and get the services to prevent recidivism? Is it
So,
both or just?
Yeah, so to make sure I understand the question, and Siwek, I'm kicking this to you.
Okay.
You're asking, can someone go directly from incarceration to the MRC, or do they typically go from incarceration into the community and then, they might
Right.
find themselves back at the MRC? Okay. Siwek, do you want to take that one?
Yeah, so it is just for individuals that have been released in the community that have failed some term of their community supervision requirements.
Okay, all right.
Yep.
Awesome. Any other
No,
questions?
I was just going to say it's a wonderful program. I don't think I knew about that. So I'm like, oh my gosh, you think you are familiar with community resources, but no,
Right.
Thank you so much. I appreciate it.
And similarly, I had the similar experience, right? I've been in this field a long time, and this was the first time I had encountered the MRC. And so before we pivot, we're going to move on to talk about the way that Scottsdale Recovery Center has approached SDOH, social determinants of health or health-related resource needs. But before we do, just pause for questions on the Justice Program and the way, anything that we've discussed so far. Would love to hear from the audience. All right, I'm not seeing any questions.
I was going to say, well, you know me, Robert. I'm always
Oh, there
here to
you go.
speak up. So,
Yeah.
Hi, guys. It's so great to see you, first and foremost. And thank you so much for sharing this information about your program and about what you've been doing to partner and collaborate. I absolutely love it. I love you all so very much. I appreciate what you do. And this has been awesome. I really do appreciate it.
Thank you. Thank you. Thank you. All right.
And who was that? Was that Jen?
Yeah.
It's Jen Barrett. Sorry.
Oh, hi, Jen. Nice to see your initials.
Yes. Always so great to see you guys.
Good to see you.
Perfect. And so, as we mentioned before in this model, a big part of the health justice program, you can see, right? Of course, there's primary care, behavioral health, and substance use recovery. But the rest of the slide, or the other half of the model, is largely focused on, non-medical drivers, right? Or these social determinants. And so, what SRC was able to do started again initially through some grant funding and some different ways to kind of tackle the challenges that folks were starting. They launched what we have called the Care Academy, which is otherwise what I call is an SDOH resource center, but it's a physical built space. And I'll throw some pictures up here for you guys, where folks could come and get those SDOH resources addressed. So Lee, if you're comfortable, I'm going to kick this over to you and ask you to kind of share or define, like, what is the SDOH Resource Center? What does it look like? What was the process to build it out? Because obviously y'all had to remodel to create and build this space. Do you mind just kind of talking about that? And then Sproule, I'll have you talk through like programming and classes and services and things. But
so there was previous occupants in the facility, and they occupied that space for a few months until we started to have the conversation about creating an opportunity for people to close up the gray areas, the gaps in service delivery. And so the really unique thing that SRC does very well is that we're very committed to ensuring that we reinforce self-efficacy, self-advocacy. And so the individuals themselves would come to us and say, and that's the great thing about being accessible. They have direct access to me and everybody on the leadership team. So they would come and say, hey, Lee, we love this program, but I wish there was some place we could get our GED. hey, Lee, I love this program, but I have an issue with finance. And every time I get a job and I have accessibility to finance, I don't know what to do with it. And then I end up exposing myself to risk of relapse. And so it was us really taking those and then incorporating programmatic enhancements to ensure we closed up the gaps in service delivery. And the great thing about it is that it was in response to what the clients were asking for. So they were very conscious about identifying barriers to success and then giving us the opportunity to refine that by implementing things like financial literacy and GED and peer support certification. And so once we started doing that, it really started to develop its own culture. So we also facilitate a program called Elevate in the SDOH, and that's a peer-driven opportunity for them to connect every week. So on Tuesdays, you literally have people that have been in the program and have successfully completed the program, but come back after 1 or 2 years with consistency to reinforce what's working for them, how they took advantage of the ancillary support services through SDOH, and to continuously perpetuate successful opportunities, whether it be in occupation, education, family, just personal opportunities for growth and development. So that's really how this whole thing came together. And thus far, we've seen tremendous success with people just really driving their own treatment and really kind of holding themselves accountable because the resources are there.
Yeah, absolutely. The work is truly profound. I remember when we were first talking about this and conceptualizing it, and again, this is not what that space looked like. I mean, it was full of offices and everything. We had to blow out walls and go through this whole, rehab process to create this space. And back then, it was a dream, right? What could we be doing here? What could these classes be? What additional needs could we meet? And so, Sproule, if you don't mind, talking a little bit about that, talk about some of the services that are being performed there or offered, any of the, impact, if there's a member story or anything that comes to mind. Please tell us about, what is going on in the Care Academy today.
Sure. Well, first and foremost, if you ever walk into the Care Academy, there's always something happening.
Yeah.
So that's kind of the beautiful part about this. It's the upstairs piece of our outpatient clinic. And it is one of those environments where you can tell that folks are always working on something for themselves as they're going forward. So we've got we have an amazing resource center manager who has done a ton of coordination and collaboration with tons of outside entities so that we can teach different coursework and different skills for all of our clients. So Lee touched on a few of these, but we have built into our schedule financial literacy classes twice a week. We have Love and Logic, which is more of a parent-child like parenting relationships. Fun fact, we're trying to see how we can get that to qualify for DCS so that we can continue to help folks that are struggling with the DCS custody of their children or any DCS cases that they might have open. We have nutrition in recovery where folks are taught a ton of skills related to their health and wellness and how food and exercise are incredibly important in recovery. Lee also does restoration, health, and healing. So he teaches some of the cultural components, the spiritual components in the SDOH center. We have offices on the outskirts as well. So our case managers and our peer support folks will spend a lot of time with our clients with their resumes and connecting them with the RSA VR program through DES. So that way they can have continued career coaching as they move forward. We have folks coming in from GCU and other educational institutions to teach our folks what they can do to further their education. BMO Bank comes in and does financial courses. Goodness, what am I missing, guys? Is that it? I mean, it is a lot. It's a lot.
And it evolves, right? I mean,
And it evolves.
through some of these partnerships, and as you talk to members and as they articulate new needs,
we try to find a way to meet it. Yeah. And that's where a lot of this, the brainchild of this came from. That's where a lot of our programs get developed from. As Lee had mentioned earlier, we take note of what our clients are telling us, saying what they need, and we try to find a way to integrate it. Our goal here, and not to say that we don't want to collaborate outside of Scottsdale Recovery, but we want to give folks a home. So if they don't have to leave for a service that we can provide for them, that we can have our staff take on and support, and they have familiar faces, they've built their community in recovery, we're going to find every way to do it.
Absolutely. Absolutely. And another thing that I love about this is this model, it has also scaled and grown with the organization. And so part of that work, even at the MRC, was bringing, this type of service or this type of space out there, which again, the affiliate SMC is continuing to fulfill today. And it just is a very profound thing. And uniquely, and Siwek and I were having this conversation a couple of weeks ago, is like, it seems like everything that we have been working on and developing for the last couple of years just seems to like set us up perfectly for whatever the next thing is. Right. And unfortunately, I mean, this next thing is not my favorite thing. Work requirements and community engagement things, right? Not my favorite thing at all. However, I truly believe that what you guys have built with the SDOH Resource Center, like this should be a national model for how organizations could, would, and should support members in meeting those requirements, that they can stay enrolled, maintain their coverage, get the help and treatment that they need. I think that without addressing this piece, it's a real missed opportunity for many organizations. And so just seeing how this has evolved and grown is just really cool for me personally. And I'm just a nerd, so I'll just take it. And so Sproule or Siwek, I don't know which one of you is going to be more excited to talk about outcomes, but are you guys going to rock, paper, scissors? Okay, I like it.
We'll block and tackle it together.
All right, perfect. But obviously, the combination of services for folks that are justice involved, coming in, of course, they're getting their, their primary care, their behavioral health, their substance use treatment needs met. For those tribal members, everything that has been built with Restoration, Health and Healing, which is the formal name of that program. Forgive me, I should have included that on the slides. The way that we've been able to incorporate, that cultural lens and then really address these SDOH needs has resulted in a real impact and in actual measurable results. And so Sproule and Siwek, I don't know which one of you wants to maybe take the lead here, but talk about what this looks like. And you don't have to talk about, these data points necessarily, broadly, like what is the conversation in the hallway? Talk about those alumni, talk about folks that are the real life living proof of the impact you're having.
Yeah, I'm good to take this. Siwek, are you good? You want to jump in whenever you're ready? Okay. Sounds great. So one of the primary tools that we use to measure progress over time is the BAM, which is the Brief Addiction Monitor. For those of you that are not familiar, it is about a 28 question scale that looks at 3 primary factors. It looks at your use factor, so how much substances are you actually using, what your risks factors are, so what potential risks, what are your environmental, internal, et cetera, risks that might perpetuate or get you back to using. My words are escaping me today. And then also protective factors. So what are the environmental things and your own self-sufficiency that support you abstaining from substances? This scale is done on entry, and then every 30 days thereafter, we have a really cool app that we use that we are able to get survey results from folks either on their phones if they have them, or we help support them while they're in the clinic or in any of our services. And so this scale, over the course of time, we want to pay attention to risk factors and use factors decreasing and of their protective factors increasing. So generally speaking, when folks are in community, in treatment, when they're getting the support and the necessary services, those factors, those scales go the direction that we want them to. And we have seen that mirrored in the results of what we've discovered throughout our work with the reentry population. If we are able to put them into a community of folks that understand, wrap around the services that they need, not just their mental health and their substance use disorder support systems, but their peer support, their educational and vocational needs, their their transportation needs, their housing needs, then we start to see over time that the likelihood of their protective factors increasing is higher. And then their actual use and risk factors start to decrease over time. So we always like to say like lower is better when we're talking about risk of use. That means that they're starting to like develop an environment that's going to support them in their active recovery, not just staying away from substances. So throughout the course of my time here, we've been using this scale, and it's really been fun to watch with the reentry population because they are obviously a very specialty population, but they also follow they have the same needs, right? They have the needs of community and love and support, and being heard and being around folks that understand it. We do see, when things start to shift, right? When an individual is in community and they're in a housing program, and maybe more in wraparound services. And then they start to peel back, as our clients do, because eventually they start to transition into a standard outpatient level of care. Maybe they're only coming in a few times a week or once or twice a month for their MAT medications. They're inserted and exposed into their environment external from what they've built in their community. And so that is always a good clinical indicator for us. If some of those scales start to shift a bit, what additional wraparound services does that individual need? So we like to use these scales to inform clinical intervention, medical intervention, our case management intervention. So yeah, am I missing anything?
No, absolutely. Siwek, is there anything else you wanted to add? I know you're a big fan of your
Outcomes.
I do love outcomes. I really do. And I'm going to say this to the group. I'm just curious. Can you raise your hand if your agency tracks outcomes? I'm just curious. Come on.
Yeah,
One?
Yeah.
Two?
Yeah.
How many we got? Two. Okay.
We got three.
So
We got three.
Three. Okay. Okay. All right. So here's what I'm going to say about outcomes. Like that all sounds magical, and we love doing it. We painstakingly had to track outcomes manually. Like we really put all of our eggs in one basket because our EMR said we're going to stand up some outcome tools for you. And we really hung on to hope. And then we continually tracked them manually. And I got to tell you, there's so much to be said about outcomes. We know what our clients need. And but without those tracking mechanisms, and certainly doing it manually as you're growing like a weed, it almost became impossible. And so we looked at Power BI, I want to say 3 years ago. And I think it's funny that Robert stood it up in 4 days or whatever he stood it up in. And we literally went a year and a half. We just could not get this thing off the ground. And Power BI is the bane of my existence. But I can tell you today that it's working. And any of you that ever want to see Power BI, you call me, because I think it is the coolest thing. And it was the hardest thing we've done. You think it'd be treating patients? No, this Power BI wanted to put hands on somebody over it. But it is so fascinating now that we have these tools literally at the click of a mouse. We can track so many things. And then that app that Michelle mentioned, it's an app on their phone. It's in that Apple store. They download it on their phone, and we push out surveys to them, and we really get some anonymous feedback about how they're doing after they left treatment. And that's always been the biggest barrier, is that disconnection with our clients. And so it has really become just a mission of ours to make sure, because those lead into all kinds of positive things with payers, and also being able to get the outcomes, see what's not working, and change up our programming to make a difference. So that's all I'll say about outcomes.
No, thank you, thank you. And I do want to definitely get to questions. So if you have questions, please put them in the chat box. And we, of course, will open the floor for you if we need to do that. But before we do, or as folks put their question in the chat box, I'm going to do a big casting call to all three of y'all and ask about the biggest lessons learned. These can be clinical things, they can be operational things, but over this process, it's going on a couple of years now as you guys have evolved and built out these programs and where you are today. What would you say are those biggest lessons?
I'm going to say persistence is key. There is a lot of cross collaboration that we've had to do with a lot of entities that maybe at first struggled to want to collaborate. We all want the same thing, right? We all want our members to get better. But I think that initially it was a struggle. So being really thoughtful about how we're communicating with our community partners, so that way we can be on the same side of the problem. And sometimes that means I have to educate a lot of folks on what clinical work is because it's not their world. And I had to learn so much about the justice world. And I'm still learning to this day and still has not ended. So I think, a big piece of this has been, if we don't have the right people with the right passion to stand it up, it won't happen. And we were very fortunate that we have an amazing team of individuals that have critical thinking and are really driven and passionate about the work that they do. So I don't know if that's a lessons learned so much as it's just like insight into how this process has been for me.
Perfect. Lee, anything from your perspective?
For me personally, I just really have looked at this opportunity as a platform to consistently produce thoughts and ideas that are going to expand and to create a pathway for us to continuously evolve to meet the client need. And that required a lot of humility. You know what I mean? To be able to ask the individuals that we're here to serve, what do you need? Rather than coming from a perspective of, we as trained professionals know the answer and we have the remedy to the problem, but really getting to identify that need coming from the people that we're here to serve. And so when we really started to do that, it really refined processes, and it was kind of like a no-brainer, something that I think that all industry leaders should do. But ultimately, I think for me, it was just we consistently have created opportunities to grow and to expand. And that, I think one of my bigger fears was I didn't want to lose the culture of the organization as we continue to grow. But there definitely is a way to do it. And we've kept a pulse on everything throughout the continued growth and expansion of the organization. And that's one thing that I take great pride in, is that we haven't lost the culture of SRC.
Yeah, y'all have evolved it. So, I mean this is a compliment, like just seeing how rich it is now, you know what I mean? And having all these different layers and I don't know the stat off the top of my head, so I would keep me honest here, but I think 93% of your staff have lived experience, or 83, some very, very high number. I think it ends in a 3, but but my point being is that, that authentic, we get it, we've lived it, we've been there. That just is so profound. Siwek, I do want to make sure that you get a chance to share your own lessons learned. And then I'll also throw the curveball at you of what's next. If there's additional stuff that you guys are continuing to build on and grow, please feel free to share all those things too.
Okay. Biggest lesson learned. I wish that I would have gotten involved in policy a lot earlier. The legislative process, all of that, talking to my senators, my representatives, not only in the area that I live, but the area where our facilities are located. I wish I would have done that a lot earlier, because it's so important for us to be involved in the process and educate our policymakers on what addiction looks like today. I can't tell you how many times I am just blown away at what little is known about addiction down at the Capitol, and it's not anything against anyone. It's just them. They got a lot going on. They can't be subject matter experts in everything, but we can be, and we should do more. And sometimes the state does balance the budget on the backs of the addicted and the poor, sometimes. And so it's our responsibility to educate so that there's always a pathway for our patients to find recovery. And it always, there's always something going on. To give you an example, like Kratom should be banned about 1.5 years ago. And what we see in our detox center is astounding. That you can still buy this at a gas station in Arizona. And so when we talk to legislators about that, they don't know anything about Kratom unless they hear a soundbite somewhere. So I think it's really important. I think we all have a duty to be more involved with that side. I will say it's not my favorite, really isn't, but it is so necessary to continue because we all know that the drugs change out on the street. Everything is just, we cannot stay status quo. It's always evolving. So that's what I would say, probably my biggest learning lesson in all of this. And what's in store for SRC? Well, we've all talked about this at several of our internal meetings, but really continuing to build out our housing model, not just for sober living, but long-term recovery housing. There's no magic number for how long somebody needs to be in housing before they really get their sea legs underneath them and they can stand on their own 2 feet. And there's just not enough housing out there for those in recovery, especially the ones that are in recovery and have a history of felonies. They struggle with finding housing, and I would love to fix that. So I have a feeling, talk to us in a couple of years. We'll see how we do.
Perfect. And you literally ended your sentence right as the clock struck 1. So we are at our time. If you don't mind, quickly scan this QR code for us and fill out our survey so we can know how we did today. We cannot thank you enough for joining us. Please, please, please check out our website, hess3.com. If you go under events, that's where you'll find our networking events, our volunteering events. If you go under the Health Insights Hub, you will be able to find our next month's Power Hour training, which is going to be again with Maricopa County and Pima County on heat relief strategies. And we are always available and willing to help chat and explore what's going on in your world. We would love to support you. So again, thank you for joining us today. And we hope that you have a fantastic rest of your afternoon.
Yeah. Thanks, everybody.
Thank you.
Bye.
Thank you. Have a good day.
You too.